have Mayor Pro Tem Dave Martin with me and Councilmember Edward Pollard of District J, along with Dr. Purrs, Chief Fenner, and Chief Pena. Over here, okay. Okay, well, let's get right in. Thank you all for joining us again today. Today, the Houston Health Department reports 1,317 new cases of COVID-19, bringing Houston's total to 20,011. Again, bear in mind, this is a two-day report, Sunday and Monday, but 1,317. On average, I think we are reporting about 700 a day, maybe a little over 700 a day. And this is it's a two-day cumulative total because Health Department does not report on Sundays, although I think this coming Sunday we plan on changing that because of the holiday period, and I think we'll be reporting on Sunday, may not be reporting on Saturday. The number of people who have died as a result of COVID-19 is now 224. That is, we are adding 5 to bring that total to 224. The 5 people that we are adding to the list includes a white male in his 70s with underlying health conditions who passed away on June the 8th. What we are noticing and what you will see is that the number of Hispanics that have been affected seem like that number is also increasing. A Hispanic male in his 90s with underlying health conditions who passed away on June 16th. A Hispanic male in his 60s with underlying health conditions who passed away on May 27th. A Hispanic male in his 50s with underlying health conditions who passed away on June the 7th. And a Hispanic female in her 30s with underlying health conditions who passed away on June 18th. So again, let me remind everyone, this virus is still very much prevalent within our community, and it is deadly. It's insidious, so please take it very seriously. Of the 224 total deaths, 64 are associated with nursing homes and 3 in the Harris County Jail. The number in the Harris County Jail has remained the same for quite some time. With respect to the nursing home deaths, that number continues to inch forward. So of the 224, 64 are associated with nursing homes. Even though, relatively speaking, the fatality rate in the city of Houston remains relatively low, the number of people who are being infected by this virus continues to exponentially grow. Each day I start with the numbers as a reminder that we are still in the middle of a global health pandemic. We are experiencing a surge currently in the city of Houston, and the positivity rate is up along with hospitalizations. Dr. Purse will speak more to it, but at the end of April, first part of May, and probably all through May, our positivity rate was at 3%, got it down to about 3, and then it jumped up to 9, and then it jumped up to, it is now above 13. And Dr. Purse can elaborate on that. We cannot lose focus that our goal is to bring the number down, to blunt the progression of this virus, and to make sure that our healthcare delivery system is not overwhelmed and prevent people from getting the virus and save lives. That was our goal 2 months ago. That remains our goal today. Doctors are telling us that young people persons are getting sick, those in their 20s, their 30s, and their 40s. And as you can see today, one of the persons who died is in her 30s. Let me just say, as of this morning, like on previous days, the testing capacity at Del Mar and Butler reached this capacity quite early, before noon today. And so to try to offset some of that, I think starting tomorrow, we will be increasing the testing capacity at both sites, Del Mar and Butler, to 650 per site. So instead of 500, we are taking it up to 650, and then we're working to increase the testing that's occurring in the city of Houston. Last week, additional restrictions were imposed by the state of Texas. And I want to thank those bars and clubs that adhered to the order issued by the governor and shut down. I want to thank them. I want to thank those restaurants who reduced their occupancy from 75% to 50%. So let me thank you for complying. Unfortunately, not all businesses complied without getting additional pressure over the weekend. And today, I'm announcing the first 3 businesses. And quite frankly, I don't want to put any businesses on the wall of shame, but we will be announcing there will be 3 that are being placed on the wall. This is how the businesses were selected over the weekend. The Houston Fire Marshal responded to complaints, and after receiving a complaint, they evaluated whether the business possessed a current permit from the Texas Alcohol Beverage Commission. If the business was in the process of securing a TABC blue tag, but currently held a red tag, then they are not allowed to have patrons inside their facility in accordance with the governor's executive order, which means if they receive 51% of their business from alcoholic sales, then they are supposed to be closed and no patrons allowed. And then if that were the case, we referred them to TABC for noncompliance. 3 businesses that are being placed on the mayor's wall of shame are the Spire nightclub at 1720 Main Street, Poor Behavior, and that's the name of the business, Poor Behavior, at 2211 Travis, and Prospect Parks Sports Bar and Kitchen at 3100 Fountain View. These are businesses that, quite frankly, are just not serving their patrons well and not serving the city well. And I'm hoping that other businesses will not have to be added to this wall of shame. We don't want to see any businesses placed there, but this is a healthcare crisis. The numbers are going in the wrong direction, and it's going to take all of us working together collectively to make it happen. So let me just say, we are taking it very, very seriously, and I think people know. You shouldn't be in a crowded capacity, shoulder to shoulder, not wearing a mask. That simply is a formula to be infected. So you don't want that to happen. If you are going to a place and you see that a place shouldn't be open, but it is open, you shouldn't be walking into the doors. And then if you're going in a place that is crowded, where you can't engage in social distancing, people don't have in their masks, then you should turn around and walk out. It makes no sense for you to be spotlighted and highlighted on local and national news and on social media in the midst of a healthcare crisis. This is real. People are dying. People are getting sick. People are going to the hospital. People are in ICU beds, and people who are asymptomatic or infecting their loved ones. So it just doesn't make sense. And quite frankly, I have lost patience with you on that regard. So this is not a political deal. Wearing masks is not based on ideology. Those who are wearing masks doesn't mean that you're liberal and progressive. And if you don't wear a mask, doesn't mean that you're conservative or something else. The reality is that we are all in this together, and we have to blunt the progression of this virus, and we have to do it now. And if we start doing it now collectively, then I think our numbers will be better 2 to 3 weeks from now. But the numbers need to go down. We shouldn't be saying 600 today or 700. We need to get to the point where we were at the end of April, first part of May, and that's numbers, 100 or less, and hopefully to the point where it can be and get to the single digits. So that's where we need to go. I take no pride in being on local or national news, talking about where Houston is and the numbers growing, and our hospitals could be overrun and ICU beds, and take no pride in that. Take no pride in people saying that if Houstonians go to another state, like on the East Coast, that they will have to quarantine, and certainly take no pride in the fact that when people say Americans, if they go to Europe, that you can't come. Take no pride in that. So what I do take pride is that when we work together, we can make positive things happen, and I'm hoping Houstonians will do just that. Having said that, let me pause now and bring up Dr. Peirce.
Thank you, Mayor. And I'm going to pick up on the Mayor's comments about the positivity rate. So again, this is the number of tests that come back positive divided by the total number of tests that are performed. And it had been expected by many, including myself, that as more and more tests were going to be available across the community, that we would wind up testing more people who were classified as the worried well. And if that had happened, we would expect to see the positivity rate would decrease because there would be a larger denominator, and yet the number of people infected would probably remain about the same. But that is not what we have seen. The positive rate of the tests has continued to go up. And as that happens, in concert with more tests being available, and we're about to go to even more tests, and we go from a total of 1,000 per day to 1,300 per day, it'll be an interesting opportunity for us to see. But my fear is that we'll see that number continue to rise. So I think that people need to pay close attention to that. And what that reflects, of course, is not that complicated, is that there is more virus in the community than previously suspected. And that also should not be too much of a surprise at this point. Perhaps several weeks ago it might have been, but certainly at this point we're way past that. That's what we should have all expected. I also want to comment on the fact that yesterday I had the opportunity to travel to Dallas to meet with Dr. Birx, who's the chairperson for the President's Commission on the Coronavirus Response. And I was there along with colleagues from Dallas, San Antonio, Austin, and El Paso, and from some representatives from the state. Dr. Hellerstadt and Dr. Zerwas were there as well. And Dr. Birx focused a lot on her concern about younger people, the 20 to 30 and 30 to 40-year-old age group, and how the concern right now is that this group that is doing fairly well when they get infected, they don't get as ill, but that is the group that is going to places, as the mayor just put on the wall of shame, and spreading the virus amongst each other. And yes, those younger people do tend to do better when they get ill. They also tend to do two things. One is they go home and they spread it to other family members, who then spread it to other family members, and somewhere in that network is an elder person or someone with chronic, serious underlying illnesses. And remember, last week we did report someone in their 20s with underlying illnesses who passed, and today someone in their 30s with underlying illnesses who passed. And in each one of those cases, for every single one of these deaths, somebody passed the virus on to somebody else, and then eventually it got to this person who paid the ultimate consequence for that. And I wanted to point out that, so today I called colleagues at local hospitals and asked, what % of your ICU patients are under the age of 40? And I don't have answers back from all of them yet, and I promised them that I wouldn't share who said what. But what is important to know is, as I say that, I want you all to think for a moment, what % do you think are people in the intensive care unit that are in their 20s or in their 30s? Based on what we've been hearing, what % do you think it is? Well, it sounds like it's going to be around 15% of the people in the intensive care units are in their 20s or 30s. They're in the intensive care unit. They are extremely ill. Now, when we look at the deaths, we are seeing mostly people above the age of 60. But don't for a moment think that when people get ill with this virus, that it's like the cold or it's like the flu even. We've heard many anecdotes and testimony that the mayor has had people up here talking about how very, very sick people feel. And so here we stand today with this virus spreading throughout the community. We're seeing the positivity rate go up. There is a concern that our younger folks are the ones who seem invincible and may be facilitating the spread, not because they're bad people, and that's not what I'm saying. It's normal behavior. I was 20 in my 30s as well, and I remember how I behaved. I was a very social person at that point. But if they think that I'm going to get sick and I'll get over it, if that's what people that age are thinking, I'll get sick and I'll get over it, recognize that somewhere in the neighborhood of 15% of the ICU patients right now are in their 20s and 30s. And so think twice before you go out and think that you won't get terribly ill with it. Thank you, Mayor.
I also failed to mention that all city-sponsored, permitted, and produced events for the month of July are being suspended. So we're not going to proceed with any city-sponsored, permitted, or produced event in the city of Houston. Those events for July are being suspended. Chief Pena.
Thank you, Mayor. I want to take this opportunity to share a little bit about the impact that the increased number of cases is having on our 911 system. Over the last month or so, our call volume has gone up by about 30%. So at the end of April, early May, we were around 800 calls for service per day. Now, consistently, we're close to 1,100 calls every shift. The increase is primarily in respiratory difficulty calls. Okay, we're seeing that day in and day out. That is having an impact on the saturation at our local hospitals, and we're seeing the impact of that in our availability of units. Okay, we have I shared this at the last press conference. Over the last 3 weeks, we've had over 560 instances where our ambulances are at the hospital waiting to give report and transfer the patient for over an hour. That has an impact on our ability to be in service on the street and ready to respond to the next call. Okay? So this is an issue. What we've been talking about here, the rate of exposure, the rate of contamination, and the spread of this virus is having an impact on the number of calls that we get at the 911 system, and it's having a downstream impact on our unit availability. So again, I want to reiterate, as a community, we're not defenseless. There are things that we can do, and we've been hammering at these day in and day out. Wearing your mask is key. Physical distancing and proper hygiene is going to help us get over that hump and hopefully get back to normal sooner than later. Look, this disengagement and the complacency is again just as much of an enemy as the virus itself. So we asked the community, one, to do their part, and two, to make proper use of the 911 system. Okay, we have the 911 system is reserved for true medical emergencies or safety emergencies if it's a police issue. We don't transport patients to the hospitals to get tested for coronavirus. If you have symptoms where you're getting aches or fever and you can go to a primary care physician, we recommend that you do that first instead of calling 911, tying up a unit, and you're going to be, I just want to make this clear, because you go by ambulance does not mean that you're going to be seen sooner at the hospital. Okay? Now, if it's a true emergency, heart attack, stroke, respiratory distress, call 911. That's what we're there for. We do not want to discourage anybody from calling 911 in those instances. But please reserve the 911 system for true medical or safety emergencies. In regards to the occupancy task force, over the weekend, after the governor's executive order was implemented on Friday, we responded to over 300 complaints for businesses that are open, bars, clubs, and not hotels, but restaurants, restaurants over the 50% occupancy. Over 300 calls that we responded to. We referred 3 businesses to TABC. Now, under the mayor's direction, the posture that we're taking is, again, education and voluntary compliance. Of the vast majority of those calls that we responded to, the vast majority of those voluntarily complied with the governor's order. Again, it was only in 2 instances, 3 really, that the businesses did not want to comply. On those, we simply referred those to TABC, and they would take whatever administrative actions they need to take. But again, as a community, we need to do our part to ensure that that we're trying to stem the increase in virus and contamination, because it is having an impact on not only our firefighters, police officers, but the people that we serve. Thank you.
Thanks, Chief. Chief Henner, HPD.
Thank you, Mayor. Thank you for your leadership. I just want to give a quick update for the numbers with HPD. We have a total of 190 quarantined, 140 tested positive. Year-to-date, 220 tested positive. 80 of those have returned home. Just real quick, and Chief Penn, you said it, we got to work as a community, okay? It's really not fair to, and I've received several calls over the weekend and today from good, responsible bar and club owners, okay? So just understand this one thing. You're going to get hit in the pocket with TABC. So if you want to play the games, and I'm not talking to all good people, I'm talking to the knuckleheads that's not out here doing what they need to do and not being community responsible people. We're going to have our vice units out there working, our patrol units working with the fire department and also TABC to report. So let's work together and get our community back up standing. And it's really hard and on the good bar owners and managers that's doing the right thing. We ask them to continue to do the right thing, and also know we're going to hold those who not, we're going to hold them accountable and get our city back up and running. Thanks.
Thanks, Chief Fenner, and let me echo his comments. For those businesses who are complying, let me thank you. For those Houstonians who are working with us and putting on your mask, engaged in social distancing and exercising proper hygiene, let me thank you as well. And it's more that are doing that than not. So I don't want to lose sight of that, so let me thank you. I'm simply asking everyone in order to blunt the progression of this virus to join in that effort, and the quicker we do so collectively, the quicker we can have more positive results. Having said that, take any questions.
Hey, Mayor, I'm going to ask some of the pool questions on behalf of the pool today.
Sure.
Start out with, there's a lot of hubbub over TMC COVID dashboard going down with part of the weekend. You know, they didn't update the data since Thursday. They re-updated it. Has been reported, it was like they changed the graphics, made all the red colors disappear. Are you aware of what prompted that, or including any political pressure to reform the dashboard to make it less scary? And what are your thoughts on that?
I'm not aware of what caused the changes in the first place. I'm not aware. I certainly would encourage to kind of go back to make sure that everything that was in there before that they put back there as it was before. If they want to add any additional graphs, you know, I think that's fine to provide as much information as possible. But in a time like this, when the numbers are going up and the eyes are certainly on the city of Houston and where we are, I do think it's important for us just to continue to be consistent. When people get used to seeing things a certain way and you start changing it, it just raises questions. So I would say go back to the way that they were doing it, and then if they want to add additional charts with additional information, then that's perfectly fine.
The Texas Medical Center, and I guess from some of the governor's statements and things like that, there's been created some confusion for people.
True.
How scared or unscared should we be about capacity and whether or not if any of us get sick, we would be able to get care at the medical center?
Well, I think we need to be deeply concerned if we don't get this virus under control, manage it much better, flatten the curve, slow the progression, then the system can be overwhelmed. And if it's overwhelmed, it's going to impact everyone. If you have a heart attack, you're going to be impacted. If you have some other illness other than COVID-19, you will be impacted. And so we all need to be concerned. We all need to be concerned. There's not an inexhaustible supply of capacity of beds out there. So it's in everyone's best interest to work to slow the progression of this virus. It is also important for us to provide the facts and tell people to be truthful to Houstonians. People can take the truth, okay? So we just need to give it to them, whatever it is, the good, bad, the ugly. People need to know what the capacity is, and those numbers should be easy to find. They need to know how many people have been admitted, what are the ICU beds, what's their utilization, what's the positivity rate, you know, what the trends are, the direction in which we're going. All of that information is important because in order for people to make informed decisions, they need to have the information. And there are some people who are reluctant to put on the mask, but if they understand that the situation is dire or whatever the situation is, then that may prompt them to do something that they otherwise would not have done. Same thing with businesses and others. People want to stay open, but you can't have a healthy economy if the patrons, the customers are sick as well. So information is important, and the truthful information is important as well. So whatever information is out there, we need to make it available. Let's put it that way.
KPRC wants to know if you just said you're increasing testing
Yes.
at the two city sites. Are there plans for more testing sites? Do you guys know like what percentage of our city has even been tested? And what's the sustainability for our additional testing sites? And of course, Dr. Purse.
Yeah, let me answer just a portion, then I yield to Dr. Purse. I know on the two main, the main testing sites, Butler and Del Mar, the capacity on those sites will be increasing from 500 to 650 each. So that will be happening. I did talk to Director Williams over the weekend and even today, and so we are working to increase the number of testing, not just sites, but capacity throughout the city of Houston. So that's a high priority because it's clear that there's a demand that's out there, and we need to ramp up as best we can to meet that demand. And bear in mind, we're testing people who are symptomatic as well as asymptomatic, and we want to certainly make sure that people who want to be tested, that they are tested. Dr. Purse?
Yeah, so the one thing to keep in mind about testing sites is that the two big stadium-based sites get a lot of attention. But equally important are the sites that we have that go into the neighborhoods that we know either by zip code analysis that there's not a lot of people who've been tested, and those are neighborhoods that we know have got a lot of chronic illness. So those are equally important. So we're trying to ramp up both of those. And you'll notice that every week, if you go to our webpage, you'll notice every week the locations change a little bit. And that's because we're trying to target those zip codes that have got low testing to date and also have a high risk based on the information that we have about those neighborhoods. And the other part of your question was about do we know what % of the population has been tested? And I don't have that off the top of my head. We can get it for you. But it's going to be, you won't be impressed because there's a population of 2.3 million people. We have a lot of Houstonians. We've done tens of thousands of tests. But at the end of the day, that's still a small percentage. So what I would say to folks is remember, two things. One is there's still a misconception if I get tested, I won't get sick. That's wrong, okay? And every one of us can, to our own personal responsibility, and change the course of this, whether you get tested or not. So it's, anyway, so testing is important, but the most important thing is to protect yourself and your family members from getting sick in the first place.
Yeah.
And if I can add, we're also working with our partners, just like on yesterday, on Sunday, at the Mexican consular office. They tested, I would say probably about 1,300 people on yesterday, so that was a tremendous plus, working in collaboration with UMMC, and then UMMC has done some additional testing throughout the city of Houston. So we have the city's testing sites, and then we're working in partnership with others as well. So there's a lot more testing that's occurring in the city other than just at the city-sponsored sites.
And on the clarification, the mayor or the fire chief, on the wall of shame thing that you guys, of the three entities, you guys have given them a warning. They didn't seem like they want to go along by shutting it down, and you guys have no power to shut them down right now, right? Like they could still open tomorrow, but you're waiting for TABC to take some action. Is that, you're hoping public shaming will cause them to
If
act?
they are receiving 51% of their revenue from alcohol sales, then the governor's order says they should have stopped operating as of noon on Friday. They should be closed. There's no reason for them to be open. Some may choose to defy that and stay open, and then we refer them to TABC, even more so. And then they go on the wall of shame, the WOS. They get the WOS award with exclamation point, underscored, And then now there are some who are shifting where they have designated as a club or bar because they're getting 51%, but they're saying we're now going to increase our restaurant sales and fall underneath, then they have to apply to TABC for a different sort of permit. One or two of them are seeking to do that. And then there are some who are seeking to say we're not going to sell alcohol, but we are going now to go to BYOB. We're going to bring our own. They would fall outside, in many cases, the governor's order, and so we're having to deal with those things. That's why if my recommendation, for example, would be to the governor to expand the authority to even deal with these establishments, BYOB, and other outlets or entities where you still have not obeying the occupancy requirements and they're falling through the loophole, so to speak. We need to address those establishments as well. But let me yield to Chief Payne.
Are you surprised by their creativity, some of these folks, Chief?
Thank you, Mayor. So certainly there's a lot of what ifs, and there's a lot of ways that they can work around the letter of the governor's order. But for us, we're keeping it simple. And I just want to reiterate the fact that we've responded to 300 or so complaints, okay? And the vast majority of those businesses have done the right thing, and we sought voluntary compliance. So I want to thank those businesses and the inspectors that are going out there and doing the education, because it takes time. It's an interaction that takes some time to do. But our position has been, we go in there, try to gain voluntary compliance. If the business refuses to comply with the executive order, then we make the referral to TABC. TABC has, we've been working collaboratively with them. Matter of fact, on Saturday or Friday, they responded within 30 minutes. Okay, so we want to thank them again for their responsiveness to address the issues, and we're going to continue in that way. But yes, there's a whole host of ways that we can work around, or they can work around the letter of the law. And in the end, we want them to do the right thing. It's about the public safety.
Yeah, I wanted to ask a question of Dr. Peirce in regards to the daily new case count. And
Did you say Dr. Peirce?
Yes.
Okay. Can I
Yeah,
help you?
in regards to the daily new.
I'm not Dr. Peirce.
The issue of delayed test results.
Yes.
Because looking at the dashboard right now, we haven't seen a daily new case high since June 11th, when Harris County had 811 new cases. Houston had 618 new cases. And then the curve's gone down from there. And for instance, the 1,300 new cases today, those are results
2
from
days.
over many days'
That's
time.
That's just 2 days.
People who were maybe tested last week and the results just got back.
Yeah. So, all right, so this is important. So depending on where you look, it's easy to get confused. So when we report our City of Houston data here daily, we're telling you how many cases were reported by the labs in the previous 24 hours. Now, when we report that to Harris County, they put it on their dashboard. We've then had enough time to correct that so that that test is now falling on the date that the sample was obtained. So because as soon as we get it, we're sharing it with the mayor, and so this 1,317 that we're reporting today are the numbers that we got from labs positives Saturday and Sunday. So what happens now is we now go back and find out, okay, well, this test was actually done on last Monday, this other test was done on 2 Mondays ago, this other test was done on Wednesday, and that gets corrected when it goes to the Harris County webpage. So that may be part of why, and so you're always going to see a drop-off over the last few days. You're always going to see that drop-off because we have yet to correct for the lab reports that we haven't received yet. Does that make sense?
Yeah, but over the past 2.5 weeks, that June 11th has stayed steady because I've been watching it.
Yeah.
So do you think daily new cases are going down now, since we kind of had
No,
that?
I think that's, now, June 11th is a ways back, right? But because our hospitalizations are continuing to go up, and that is more real time, right? Because they're able to, somebody either got hospitalized or they didn't, and the hospitals are reporting that to us very promptly. So I find that to be a much more sensitive indicator of what's going on, because we still have this problem with, and you've seen that we were then sometimes getting these huge dumps of data from the labs, where we're getting many days worth of data all in one day, and we go back and we correct. So while I recognize that, and it's on my radar, I'm also looking at the daily hospitalizations. So as the slope of that keeps going the direction it is, I know that the test data is just going to catch up at some point.
Okay, and I'm glad that the mayor was able to respond to what Texas Medical Center has kind of done over the weekend. I wanted to get your response as well
Yeah.
to their reporting on hospitalization. Is that comforting to you that they're saying, we don't see a way that we're going to reach a point where we can't take more COVID-19 patients?
Well, I certainly can't speak for the Texas Medical Center, and I'd ask you to talk to them directly. I am encouraged by how they are talking about, and I know that you haven't been a physician myself and worked in ERs during crises. There are things that you can do to expand capacity for taking care of certain types of patients. And so in my career, we've had times when we've had to figure out ways to all of a sudden quickly take care of more dialysis patients than we ever had before because of bizarre situations that occurred in the community where a whole bunch of dialysis resources suddenly closed up shop, right? And so there are ways that you can quickly adjust. In this case, they're adjusting for if they need more ICU beds, and there are ways to do that. It's not easy. It takes planning. And what I'm getting from the Texas Medical Center is they're looking forward, and they're trying to go and prepare to do those things. But at the same time, they want to make sure, Chief Pena pointed out, and I want everybody to make sure, is that we are simultaneously still have to have the ability to take care of heart attacks and strokes, women who are having babies, cancer patients that need tumors removed. All of those other important healthcare needs continue to exist. And so we've got to be able to take care of them as well and not focus solely on COVID when we're talking at the hospital level.
Thank you.
A question for Dr. First, now that I didn't the mic. So with the video that we saw on Spire nightclub, and you saw the images of people just partying, like if it was just a normal day or night, talking from a health perspective, what are some of the repercussions that we can see by that day, by that night? The dangers of maybe, having a positive case inside that nightclub, what could be the results on that?
Well, that has probably been going on this whole time, unfortunately. And this is exactly the type of behavior that the virus will take advantage of. And so, I can't see anything good coming of it, unfortunately. And I remember when I was young and used to like to go to the clubs, and I get it, right? Your friends are important to you, and spending time with your friends, that's what a lot of your social time is spent doing when you're in your 20s and such. But at this point, I would also look to that same generation of young people who, tend to get behind doing things that look out for others, right? It's the young folks that, I'm a product of the 60s and the 70s, and my brother was a few years older than me, and I remember the protests about the Vietnam War. That was mostly young people who were protesting about the Vietnam War back then. And so today, the enemy is not a political ideology, it's the virus. The virus is the enemy. And I would encourage the 20 and 30-year-olds to recognize that today, the thing to get behind, the thing to rally, is to fight the virus. It's hurting your friends, it's hurting your friends' families, it's hurting your grandparents. Don't give it an opportunity. Fight the virus. That's the bad guy.
A question for Chief Peña en español. Jefe, después de que vio el video de ese centro nocturno, ¿qué fue lo que le pasó por su mente en sí en cuestión a la emergencia que se vive? Al ver esas imágenes, su preocupación, ¿cuál fue?
Mire, pues estamos preocupados porque sabemos que el virus es contagioso y en las situaciones donde están bastantes personas juntas en un lugar, es donde el virus se puede pasar de una persona a otra. Esperamos que haya resultados de contaminación del virus a resultado de ese incidente. Lo que estamos haciendo nosotros, el Departamento de Bomberos, la ciudad de Houston, aquí a orden del alcalde Turner, es llegar a estos lugares y informarles de la orden ejecutiva del gobernador. Tratamos de tener que los negocios hagan las cosas que se deban para crear un ambiente más seguro. Pero estos incidentes, cuando hay bastantes personas en un lugar, el virus se van a contaminar y va a ser un peligro para ellos, para sus familias y para también los bomberos y los paramédicos que van a responder a estos incidentes.
Did you need me to translate any of that for you? I know I caught we are here with the mayor, and then I start focusing on something else, and my attention span left me.
Mayor, I did have another question regarding the impact on the Hispanic community. You mentioned, there are intentions of increasing testing in those sites, but we saw it yesterday, large numbers, huge crowds of people going to the test site at the Consulate of Mexico. Is there any intention of maybe more promotion so people are aware of these testing sites?
Yes, we want to do more of that. There's a huge demand. We are certainly seeing the impact that this virus is having on the Hispanic community, quite frankly, communities of color. But the numbers you saw today of the 5 that we're reporting who have died, 4 of the 5 were Hispanic, 1 a 30-year-old female, in her 30s. And then what we saw yesterday at the consulate, Mexican consulate, a huge demand, lines in many different directions. So that's why we want to ramp up testing, especially in sites that are closer to the communities where people live. And then I want to repeat again that testing sites in the city of Houston, all of the Texas sites are open to anyone, irrespective of nationality, irrespective of status, whether you're documented or undocumented. All of these sites are available to everyone. and we want people to take advantage. But we intend to even ramp up more sites to make them accessible to communities of color. Anything else? Thank you all.
Mr. Mayor, I'm sorry. You had one suggestion for the governor on strengthening your
Yes.
ability. How confident are you TABC can, in essence, police 5,000?
It's difficult.
And so what is it you would like to have and why?
Well, there are several things. I mean, there are some loopholes. BYOB establishments, I think they need to be covered. Quite frankly, the power to expand even the mask wearing, not just to businesses, but to any gatherings across, just across the line, whether you're a business or not. We certainly want that to be expanded. Anything dealing with like the BYOB, strip clubs, you name it, to make sure that they all fall within our ability to the healthcare risk, because quite frankly, the virus doesn't stop just because you receive 51% of your sales from alcohol. So we need more. We need more tools. If I had my ultimate ask, Ted, I would say restore to local governments, to mayors and county judges, all the tools that we had in March and April. Give us back our tools. I think people can see that what we had and how we utilized them worked. Give them back to us. And because the situation now is more critical now than then, and we had more tools at our disposal then than now. And I will tell you, it is frustrating. It is frustrating because when people are reporting locally or nationally, they are talking about the city of Houston, okay, as well as other cities. I would like to have the ability to do what I think is in the best interest of the city of Houston, to get on top of this virus. So if I had my brothers, and I do applaud him for what the steps he did take, but if I had my brothers, I would say give us back the authority that we had in March and April, to be as simple and as blunt as that, with all due respect. With respect to the TMC, let me just say I request on them, go back to your original reporting, and if you want to add more documents, do that, and be consistent. This is not a time for mixed messaging. People need to know what the situation is. We need to be very truthful and be upfront and not try to camouflage the severity of this virus. People need to know. People can accept the truth, but it becomes confusing when the messaging keeps changing. Thanks so very much. Appreciate it.